Heartburn is an issue for so many people. For some, it becomes an everyday issue and affects how a person lives their life, what they eat, their sleep, and becomes a condition that really needs to be addressed. Heartburn is also known as GERD or reflux. It's a chronic disease where abnormal amounts of stomach acid leave the stomach and enter into the esophagus, thereby causing symptoms twice or more per week and/or inflammation of the esophagus. Sometimes these symptoms are very short-lived and resolve on their own. However, around 20% or more of people will develop the chronic condition called GERD. This is a risk factor for the development of esophageal cancer. Most people come to see me for GERD as a referral from their primary care physician. Typical symptoms include heartburn, which tends to be a burning sensation in the chest. Some patients also experience regurgitation symptoms. Patients may wake up in the middle of the night with a sour taste in their mouth, and sometimes they even fully regurgitate. There are also atypical symptoms associated with reflux disease. Those can be asthmatic type symptoms, chronic clearing of the throat, chronic cough, or epigastric pain. There are also various others, but these are the most common manifestations of reflux disease. If you are having any of these symptoms, you should talk with your primary care physician and have a discussion on how you should treat heartburn and GERD symptoms moving forward. Most of the time, patients will be placed on a medication called a proton pump inhibitor. Those medications are designed to be taken for a couple of weeks to a couple of months. Most of the patients that are referred to me, however, are the patients that have failed PPI therapy or have breakthrough symptoms while taking these medications. Others may not want to take the medications for the rest of their lives or may be experiencing side effects that cause them to seek a permanent solution for their heartburn symptoms. Studies have shown that approximately 20% of patients have reflux disease. The data is based on the number of people prescribed PPI medications, so we actually think that the numbers are quite a bit higher than that because most of these medications are over the counter now. And because of that fact, people will medicate themselves without seeing their physician. This can be quite problematic because GERD can have long-term consequences. There are various types of GERD, and some of these develop erosive components. In other words, you get inflammation of the esophagus. Over time, inflammation of the esophagus can lead to what's called Barrett's esophagus, which is a precancerous condition. If left untreated, ultimately Barrett's esophagus can lead to esophageal cancer. At the Schneck Surgical Associates Heartburn Center, we reserve surgical therapy for patients who have refractory symptoms that are not controlled with the medications, those who don't want to take medications for the rest of their lives, or patients who want to have surgical definitive repair for their reflux. The surgical treatments that we offer here at the Heartburn Center are state-of-the-art. We offer treatments that are not available elsewhere. We specialize in robotic procedures, specifically toupet or Nissen fundoplication, which is a wrap of the stomach around the esophagus. The most commonly performed fundoplication here is the toupet fundoplication, which has a very low side effect profile and a very high safety and effectiveness profile. We also offer the Links, which is a magnetic beads which you will apply around the lower esophageal sphincter. Links predominantly prevents reflux and regurgitation symptoms. In addition, Links is the only device FDA approved for use in patients with prior sleeve gastrectomy, a form of bariatric surgery. And the final procedure we offer is the TIF device. This is an endoscopic therapy that is used to reconstruct the valve with sutures. The decision on which type of procedure is best for you will be made by you and your surgeon, and ultimately is dependent on the type of symptoms you have, as well as the medical history and other considerations that are discovered during your examination for reflux. All of these procedures are very safe. Major complications occur in less than 1% of all operations. Most patients can have these procedures as an outpatient, which means there is a high probability you're going to get to go home the same day of surgery. The majority of patients feel significantly better after having any one of these anti-reflux procedures. As with all surgical procedures, there is a short recovery period, but once the recovery period is passed, patients have no further reflux. Approximately 85% of all patients will come off of daily use of PPI medications for their heartburn. Most patients say they no longer wake up with a sour taste in their mouth, they are no longer having regurgitation events, and they can eat the foods that they had to avoid in the past and don't have to worry about having significant symptoms afterwards. So as a patient, if you are on daily PPI therapy or having significant reflux symptoms, I would encourage you to talk with your primary care physician about the possibilities of surgical repair. We have excellent outcomes, and it is routine for me to have patients that state I have completely changed their life by undergoing an anti-reflux procedure. So don't suffer any longer. We can help.